Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of novel coronavirus. This week, we take a look at a few presentations from the MDs Virtual Congress. First up, data from an exploratory post-hoc analysis of the BIPARC 1 and 2 trials suggests that 50 mg opicapone is a viable option as a first-line adjunctive treatment for patients with Parkinson's disease treated with levodopa who experience motor fluctuations. The assessment included 68 patients given the once-daily oral selective COMT inhibitor and 59 administered placebo, all of whom were treated with levodopa. In total, the changes from baseline in absolute off and on time were significantly greater for the opicapone group. Levodopa still remains the most effective symptomatic treatment for Parkinson's disease, poster presentator Joaquim Ferreira and colleagues wrote, noting that the post-oral administration of levodopa, the drug is extensively metabolized in the periphery by dopa decarbooxidase and COMT, opening a window for opicapone to fill. Data presented at the 2020 MDs Virtual Congress from the Progress study revealed that 90.6% of patients with Parkinson's disease had a wider therapeutic window when undergoing treatment with directional deep brain stimulation compared to omnidirectional deep brain stimulation. The study included 234 patients who received subthalamic nucleus DBS programmed with omnidirectional stimulation for 3 months, followed by directional stimulation for 3 months. A blinded off-medication evaluation of TW for directional versus conventional stimulation at 3 months, the primary endpoint of the study, was met with superiority for directional DBS. Additionally, patients showed a mean increase of TW of 41% compared to 2.11 for omnidirectional DBS. Scores on the Unified Parkinson's Disease Rating Scale Part 3 motor score were improved in both groups at both time points. Preliminary results presented at the 2020 MDs Virtual Congress demonstrated that bilateral magnetic resonance-guided focused ultrasound thalamotomy is safe and effective for the treatment of essential tremor. In efforts to prove whether MRG-FUS bilateral thalamic ablation can be tolerated, investigators assessed 5 patients who underwent a second thalamotomy on the contralateral hemisphere for non-treated tremor after receiving unilateral MRG-FUS thalamotomy for at least 1 year prior. Led by Raul Martinez Fernandez, all patients had achieved tremor control in the treated hand and did not show any permanent adverse events from the first thalamotomy. Investigators then observed the safety of the second lesion based on the evaluation of observed and/or reported treatment-related adverse events. For more direct access to expert insight and coverage of the 2020 MDs Virtual Congress, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.